Hi, how is everybody? So public speaking produces anxiety, okay? So I'm feeling it right now. I was telling Allison, this is in my mind, so I'm gonna say it. So Jerry Seinfeld has this little bit about public speaking, and you're laughing, I don't know if you've heard it before, but he says you fear public speaking more than death. So what that means is that you'd rather be in the coffin at a funeral instead of giving the eulogy. I don't know why that came to my mind. But I am very excited that you guys are here, and I'm just gonna do just a very brief 10, 15-minute kind of intro into anxiety, and then we are gonna introduce our breakout speakers, and you can decide. We actually have 3 breakout speakers, but we have 2 hours or 2 45-minute sessions, so you can pick 2 of those, and we'll kind of let you know what they are so that you can choose which is best for you. So we are going to talk about anxiety. As I was thinking about this a week ago or so, I thought about a man named George Stratton, and he was a psychologist at the turn of the century. And in school, I remember talking about the experiment he did, and he invented these goggles that he would wear. And what they did is they were like special glasses, and they would flip his vision upside down. And so he would wear these around for days and weeks at a time. And what he ended up finding out is that his brain actually would flip his vision right side up again, even though he was still wearing the glasses. His brain adapted. And so oftentimes with anxiety, I think, are really unaware that the way we see the world is distorted. And we don't realize that everyone doesn't worry excessively, or everyone doesn't think in catastrophic terms, or perhaps everyone doesn't wash their hands, 75 times a day. And I know this because we have people that come into the counseling office, and they may come for lots of different reasons, but they get there, and as they tell their story, we really begin to talk about, like, how long have you been experiencing anxiety? Or, how long have you been having these obsessive thoughts, intrusive kinds of thinking? And what has happened is that our brains have a tendency to normalize and adapt, and we just think, this is the way everybody does life. This is just normal. And so what we want to talk about today is we want to really open up this topic. I would say this topic is the #1 topic that we're asked to come and speak on. I don't know if you guys would agree, but anytime we're asked to speak, it is, can you just say something about anxiety? And so our hope is that as we give good information, and as we specifically talk about how this affects our children, that people will begin to see, what is happening and how they're adapting to life and how they're engaging in life. And if it's, in an anxious way, or if they're suffering from an anxiety disorder, or if your kids are really suffering with some kind of anxiety disorder, then you can get them the proper help, and they can gain some freedom and really begin to see the world in a less distorted way. We have a heart for kids. I know every single person here has a heart for kids. And I really only see adults, but there's so many times when I'm seeing adults and I think, I wish Allison could have seen you when you were 7 years old, or I wish Keely could have worked with you when you were 4 years old, because your life would be so much different. And so we all have a heart for kids and getting them the help that they need. Because when you help a child, you really grow an adult and you grow a family in the future. So we're going to talk about a few questions. What is anxiety? Anxiety is a multi-symptom response to a perceived threat or danger. Now, it may be an event, it may be a situation, it may be a stimulus. It can be different things, but the way you perceive it is as a threat or as a danger. It's something coming to you that's overwhelming. Almost as if that very back part of our brain, I know Allison will address this, but that very back part of our brain, the oldest part of our brain, it's experiencing that as if a saber-toothed tiger were coming at you. It's that same physical response that you have if there really is danger. So we experience that in 4 kind of components: physical, which is that increased heart rate, it's that rapid breathing. With kids, a lot of stomach pain. If your kids always are saying like, my stomach hurts, their stomach really does hurt. That is part of the anxiety. That's part of the physical response. Headaches, loss of sleep or trouble sleeping. The emotional part would be the fear, the anger. Part of that fight or flight, that fight part produces that anger. Irritability. If your kids are just kind of grumpy a lot of the time, that could be part of the anxiety. And so you have to look at it as a whole big picture. You're not just taking one component. So physical, emotional, cognitive, scary scenarios, catastrophic thinking, worst case scenario thinking, tunnel vision. Fear is very focusing. I don't know if you've ever thought about that. There was a study done sometime in the past, probably several years ago, where they interviewed people who had been robbed at gunpoint, and they asked them, like, describe where you were, describe who was there, describe the man who did it, like anything you can tell us about the surroundings. And the people could basically tell them nothing about any of the surroundings or anything that was going on. But the one thing that every single one of the people who had been robbed at gunpoint could tell you is exactly what the gun looked like in detail. And that's because fear is totally and completely focusing. And you see that in some of the disorders, like phobias, completely focused. And so you have this kind of tunnel vision, and anxiety only lets us interpret things negatively. Okay, so anxiety is not going to let you see, hey, there's an upside or there's a positive side, or how likely is that to happen? It is very likely that something terrible is going to happen. And so that's kind of the cognitive part of anxiety. The behavioral, and Josh is going to talk a lot about the behavioral in his session, but we see a lot of avoidance. So if I'm afraid of an elevator, then I'm going to take the stairs. And so I take the stairs, and that was a good thing that I took the stairs because I'm safe, and that proves that I should never take the elevator. And so you see that kind of thinking creates avoidance, and it actually reinforces like, well, of course I was safe and I didn't take the elevator. And you think that's kind of funny or that's silly, but it really does, in an anxious brain, that really does reinforce avoiding whatever it is that you're afraid of. Meltdowns, and we're going to talk a lot about that tonight. What do you do when a kid just completely melts down? How do you discipline that? That's difficult, and Josh is going to talk a lot about that. Nightmares. That can be part of the behavioral part of anxiety, and just acting out behaviors. And how to differentiate, like, is my child being disobedient or rebellious, or is this really an anxiety issue? That's very hard. It's very hard to determine how to navigate that. So that's kind of an overview of what anxiety is. What is the difference between stress and anxiety? So stress, that we all have stress. So how many of you had some stress getting here tonight? If you have children, you had stress, okay? However many kids you have, that's how much stress you had. It's part of life, and stress, you should kind of go up and respond to that stress, but then you should come back down and you're calm and everything's okay. And then another stressor, you kind of meet that situation, and then you come back down. That is more of a just stress in normal everyday life. Anxiety is the chronic, it's the long-lasting, it's debilitating at times. It interferes with your daily life. And so you're really looking for, like, okay, is this just a stressor and then life kind of goes on? Like, do I bounce back? That's a term that I've heard psychiatrists use quite a bit, is this idea of bouncing back. If you see that your child is not bouncing back and that the stress is building and building and building, it's becoming chronic, and then you see the physical and the emotional and the cognitive and the behavioral, and all of those are beginning to come together, then that is anxiety. That's more than, your child is just stressed or they have a lot going on. So it's really this idea of severity and length of time. And that's really how we kind of diagnose what we would say an anxiety disorder. And so a good question is, when is anxiety considered disordered? If you think about emotions are supposed to constantly change, okay? For some of us, that can be like 5 or 6 emotions in 1 minute, okay? For others of us, I got some laughs. For others of us, you may feel excited tonight, and then tomorrow you may read something on Facebook and you may be disappointed, and then later in the evening you may experience sadness. That's really how emotions are designed by God, I think, to change and to constantly be fluctuating. What I usually say is that when an emotion gets stuck, it's disordered, okay? So what emotion would be stuck when we're talking about depression? Sadness. What emotion is stuck when we're talking about anxiety? Fear. Fear is stuck. And so it's this idea of a pervasive feeling that lasts for a long period of time. And so when anxiety is disordered, fear becomes our main way of relating to the world. And we look for all kinds of things. We look for impairment, we look for distress, length and severity, like I mentioned. But if you have a lot of that and you have someone that's working with you, whether it's a doctor or a counselor or a psychiatrist, that diagnoses your child or you with anxiety, these are some of the types of anxiety disorders that you would see. Generalized anxiety disorder. This is worry. And a lot of times, a lot of kiddos really struggle with worry. And you can worry about anything. And you can worry about everything all at the same time. Perfectionistic tendencies. Am I going to be good enough? Am I going to make a good enough grade on this assignment? What if I don't make a good enough grade? Seeking approval from others. Reassurance seeking. If you have an anxious child, and Allison, maybe Keely are going to really explain this, is this idea of your child coming to you, is it okay? Is it okay? Am I okay? That same question, it's that same question over and over and over. And hopefully tonight you'll learn some good ways to be able to respond to your child, because when you answer them, yes, it's okay, then actually that reinforces. And it becomes like, oh, well, I need to ask my mom again, or I need to ask my dad again. That's generalized anxiety disorder. You see that a lot. Also move from one worry to another. So it doesn't matter what I'm worrying about, I'm just worrying about something. And there also can be some religious worries in there with sin or salvation, some things like that. OCD. OCD is, we could do a whole conference just on obsessive compulsive disorder. What I will say is that you can find relief. There can be healing from OCD. There can be healing from any of these anxiety disorders, but OCD is particularly crippling for children and for families. And so it's this desire to perform certain rituals, whether it's if it's a contamination fear, it's hand washing or using hand sanitizer. If it's maybe checking behaviors where they're checking locks, things like that. But it starts with this very intrusive thought, and we call that an uninvited visitor. It's like somebody that's banging on your door and demanding to come in. But OCD is really about these rituals, and it's about these intrusive thoughts. Social anxiety disorder is really about fear of social situations, and what you see a lot with social anxiety is this fear of what are other people thinking of me? Like, are they going to laugh at me? Am I going to make a mistake? Are people going to ridicule me in some way? And so that keeps kids or adults from really engaging and making friends. They want to. It's not that they don't want to make friends. It's just that that keeps them from engaging. Separation anxiety disorder, and we see that in a lot of young kids. That's uncontrollable fear. It's fear of parents dying or them not coming back. Like, is my mom going to come back to get me? And so we see a lot of crying, a lot of anger in that. Next to last is post-traumatic stress disorder, and we could talk a long time about that as well. That's usually from a traumatic event that has happened in a child's life. It can create a lot of avoidance, hypervigilance, anger. It also can create a lack of emotion. And so you might see a child that's just nothing on their face, no emotion. And then phobias, and remember we talked about fear being very focused, that it's an irrational or exaggerated fear connected with an object. That can be the dark, that can be a dog or an animal, it can be needles, heights, something like that, where your child picks one thing and they have just this very exaggerated fear of that one thing. And so hopefully that gives you just a good idea of an overview of kind of what anxiety is and the direction we're going to go.
I guess the first section is, when is anxiety normal? A lot of people don't know when anxiety becomes problematic. So it's very normal for a child to be anxious about STAR testing, about speaking in front of their class, if they have kind of a major sporting event coming up. Anxiety around those situations are perfectly normal. Where it becomes problematic is when it gets in the way of them being able to do normal daily things that they should reasonably be able to do. I always ask my parents, are they missing out on things that they should reasonably be able to do? Anxiety is basically an overestimation of threat and an underestimation of coping ability. So if they're constantly seeing things as dangerous or risky and underestimating their ability to deal with it, that's kind of when anxiety becomes problematic. So that's the difference between normal anxiety versus problematic anxiety. One of the biggest questions I get is how to talk to my child about what anxiety is. So the first thing I talk about with kids and parents is to use a fire alarm analogy, because having an anxious kid, their body is constantly in a sense of alarm. So they constantly have this feeling that there is a danger or a threat when there is not, but it's actually a false alarm. So I talk to them about, just because your body feels afraid or your emotions are fearful doesn't mean that you're actually in danger. And that's kind of a strange concept for kids, because we're kind of raised to believe if I feel like I'm threatened or in danger, then I probably am. But for an anxious kid, that is kind of, there's a glitch in that warning system. So it's constantly telling they're in danger when they're not. So helping them to understand they don't always have to react to the way their body feels is a great way to start having the conversation with their kids about anxiety. Anxious kids usually believe that their level of fear is an accurate reaction to how dangerous this situation is, and it's often not. The second thing I talk about is, if some kids are interested in biology or kind of the brain, is we talk about the amygdala. And the amygdala is actually an almond-shaped part of the brain. It's a very tiny portion, and it's responsible for that fight or flight reaction that we get when we're in danger. So I even let the kids name it. If it's an older child, we just talk about what the amygdala is and what it does. And we talk even further about the fight or flight response, and just feeling like you're afraid, feeling like you're in danger does not mean that you are. A few things I always tell parents not to say is saying relax, don't worry, is something you don't want to say to an anxious kid. It usually doesn't help. Also, not to become emotional yourself and then try to talk them out of their anxiety. That's some of the traps that parents tend to fall into. Is there anything else you would add about explaining it to kids?
Are you going to talk about reinforcing just that whole idea?
That's not yet. Yes,
okay.
That's coming up.
Okay. Then no, I don't have anything else.
Fabulous. Okay, so common red flags. So some of you may be certain that your kids have anxiety. Some may be still questioning whether or not your children are highly anxious. So some of the common red flags that show a child in excessive distress would be if they're easily agitated in stressful situations. So a lot of these kids have a low distress tolerance, so they're less able to tolerate stressful situations. Repetitive reassurance questions, I think that's what Millie was just speaking to. That's the kid that's always asking what if. So they're always coming up to you, what if this happens? What if we go and this happens? Are we gonna be there on time? Am I okay? Is this gonna make me sick? Constant reassurance questions. Now the typical parent would do what most parents do and reassure their child, right? No, everything's fine, you're not gonna be sick, this would never happen. But what you find is that never satisfies an anxious child. If you've tried it, you recognize that it's often not helpful, or if it is, it's very temporary. They're gonna always come back for more. So the reason you don't wanna over-reassure an anxious child is one, it strips them of their ability to figure it out on their own that they're okay, and it also keeps you in their kind of loop of them always needing to check in with you. You'll notice those kids check in a lot. Some kids are kind of confessors. They'll come and confess things they did. Was this bad? Is this a sin? They'll have specific questions like that. Psychosomatic complaints. This is the kids that get sent to me a lot are not going to school because they have headaches or stomach aches. So the reason those are difficult is because those are kind of ambiguous complaints that we're not sure, do we keep my child home or not? Are they sick? If they're frequent and often not accompanied by actual fever or vomiting, it could be related to anxiety. Those kids are not faking, it's not pretend, it's actually how their body is experiencing the stress and anxiety. Worrying about events in the future that may or may not ever occur. We have a lot of catastrophic thinkers that are always imagining the worst way something could turn out. A lot of my anxious kids that I see have a lot of difficulty with sleep, either falling asleep or staying asleep. And often nighttime is the time you see anxiety peak. That's when you'll get a lot of those repetitive questions. The confessing is usually right before bed. Not always, but that's a very common thing that I've seen. Perfectionistic thinking, excessive apologizing. We have a lot of kids that are constantly concerned that they've hurt someone else's feelings or done something wrong, broken a rule. Excessive avoidance of stressful situations. And we can go into that if you like. Millie touched on it a little bit. But I talk a lot about how when you allow a child to avoid stressful situations, it's a positive reinforcement because their anxiety goes down. So they meet a stressful situation, their anxiety will peak, they're allowed to avoid it, so their anxiety immediately goes down. The problem with that is they believe that whatever they avoided, they needed to because they feel better when they were able to avoid it. But what happens is if your child's world is this big, it starts to get this big. They're able to do less and less, you're able to go fewer and fewer places, and you find that you're just creating an environment for your child that's the least stressful. And it feels right for a while because it helps to manage it, but it's superficial and not long lasting, and you're often kind of a slave to your child, and their ability to meet the expectations of the world gets smaller and smaller. Disruptions of normal daily functions because of those things. Those are a lot of the common red flags we see. Do you have any questions about those or anything you want to add?
I think, is your microphone?
It is, I just hit it.
Okay. No, I think that sounds good. Tell us a little bit, like the reinforcing, what would that sound like from the child, or the confessing, what would that sound like?
So a child that is needing reassurance is, am I okay? I touch this and then touch this. Is that dirty? Do I need to wash my hands? Am I gonna be sick? I have a lot of kids with an excessive fear of vomiting specifically, or being sick. And they'll ask, am I okay? I started to not feel good, or they look sick. What if I get that?
Am I going to get food poisoning?
Yes,
that's one that
absolutely.
Yeah.
The confessing is, and it can be from the smallest thing. I think I might have hurt my friend's feelings this afternoon. I did this when you weren't looking. And they'll report or confess things that happened years ago just to clear their conscience. And when you allow them to do that, it makes their anxiety go down, but they'll continue to do it. So it's trying to help them figure out what is a reportable thing to report or confess, and what are things that we need to just let go of.
Okay.
And that's hard for them to distinguish.
Confessors, how do you speak to that?
One of the things I typically do, and it depends on the child and kind of how they're confessing. So if I have a child that's confessing things that happened years ago, I'll work with the kid on saying, okay, if this happened more than a month ago, we're going to give it to God, or we're going to let it go, or we're going to write it down, tear it up, and we're going to forget about it. It's not reportable. That's one of the things. If they're repeatedly confessing the same thing, I say you get to confess it once, and after that, you have to write it down. Most kids aren't motivated enough to want to write it down, so that will usually extinguish that desire, but it takes some time. And you have to say, I've heard this once, I'm unwilling to continue to listen to it. You have to remember your tools of how to let that go.